If you've just been diagnosed with breast cancer, you're probably feeling overwhelmed. Your surgeon is talking about lumpectomy, mastectomy, reconstruction, radiotherapy, and you're expected to make life-altering decisions when you're still processing the diagnosis. And today, I'm going to give you the 5 most important questions you need to ask your surgeon to make sure you're making the right decision for you. Because here is the thing, your surgeon should be asking these questions. But if they don't, you need to ask them yourself. Write these down, take them to your appointment, and make sure you get clear answers. So let's dive in. Before we go through the 5 questions, let me explain the 2 main surgical options for breast cancer. Lumpectomy, also called breast-conserving surgery or wide local excision. In this procedure, we remove the tumor along with the margin of healthy tissue around it. You keep most of your breast tissue. However, in most cases, you'll need radiotherapy afterwards, and that's typically 1 to 4 weeks of daily treatments. Mastectomy. This is where we remove all of the breast tissue. After mastectomy, you have several options. You can go flat, you can wear a prosthesis, or you can have reconstruction, either at the same time or later. The advantage here is that most patients don't need radiotherapy after mastectomy unless the cancer has spread to the lymph node. Now, here is what's really important to understand. For any stage breast cancer, multiple studies show that lumpectomy and mastectomy have the same survival rates. The same. So this decision isn't about which surgery will save your life, because both of these will. This is about which option fits your life, your body, and your priorities. Now, in an ideal world, your surgeon will walk you through all these questions during your consultations. And to be honest, many surgeons do. But appointments are short, you're overwhelmed, and sometimes important questions don't get asked or don't get explained. So I'm going to give you these 5 questions to take with you to your appointment. Write them down, ask them, and make sure you get clear answers. Because this is your body and you deserve to make an informed decision. So let's go through the 5 questions you need to ask your surgeon. The first question you need to ask your surgeon is lumpectomy possible in my case? And this is important because not every patient is suitable for breast-conserving surgery. Let me explain what your surgeon should be considering when they answer this question. Lumpectomy works best when your tumor is small relative to your breast size. The cancer is in one location, not multiple areas, especially if it's on both sides of the same breast. And also that we can achieve clear margins, which means removing tumor with healthy tissue around it. And also the last one, that you're able to have radiotherapy. Now, what does that mean practically? If you have small breast and a large tumor, removing that tumor might leave you with significant deformity. In that case, mastectomy may actually give you better cosmetic results. You might need a mastectomy if your tumor is large compared to your breast size. You have cancer in multiple areas of the breast, what we call multicentric disease. And the last one, you already have had radiotherapy to that breast, because you cannot have radiotherapy twice to the same area. So when you're sitting in that appointment with your surgeon, here is the exact question you need to ask. Based on my tumor size and breast size, is lumpectomy possible for me? If I have lumpectomy, what will my breast look like afterwards? Will I definitely need radiotherapy? What happens if you can't get clear margins during surgery. Write these down, take them to your next appointment, and don't leave until you get clear answers to each one. And your surgeon should be able to answer all these questions based on your specific situation. The second question you need to ask yourself and then discuss it with your surgeon is, do I want to be flat or have a breast? Now, this may seem like an obvious question, but it's actually one that many patients don't think about until their diagnosis or until their surgery. And I want you to think about this carefully because your answer will affect your surgical plan. If you choose mastectomy, you have 3 options. 1, going flat. No reconstruction, no prosthesis, and some women find this incredibly freeing. Number 2, wearing a prosthesis. This is a breast form that goes inside your bra and you can look symmetrical in clothes without having surgery. 3 is reconstruction. And this can be done at the same time as your mastectomy, or months or even years afterwards. Now, here is what I want you to understand. There is no right or wrong answer here. Some women tell me, I don't care about my breast, I just want the cancer out. And that's completely valid. And then other women might say, my breasts are important to my identity, I want reconstruction. And that's also completely valid. What you need to think about is, how important are your breasts to your sense of self? Do you want to look symmetrical in clothes or when you're naked, or both? Are you willing to wear a prosthesis? Are you willing to have additional surgery for reconstruction? And how do you feel about recovery time for reconstruction? So the questions to ask your surgeon are, if I choose mastectomy, can I go flat? What reconstruction options are available to me? Can I decide about reconstruction later, or does it have to be done at the same time? What is recovery for each option? And remember, this is your body and your decision. Your surgeon's job is to give you the medical information, but only you can decide what you can live with. And a good surgeon will support whatever decision you make. The third question to ask your surgeon is, how does my family history affect this decision? This is particularly important if you have strong family history of breast cancer. If you have a BRCA1 or BRCA2 or any other gene mutation that carries increased risk of developing cancer in the other breast or the same breast, and that risk can be between 20 and even 70% over your lifetime. In that case, many women choose to have bilateral mastectomy, which is removing both breasts to reduce that risk of developing another breast cancer. However, if you don't have one of these mutations, your risk of cancer in the other breast is much lower, so your risk might be around 13 or 14, which is similar to general population risk. Now, here is where it gets complicated. Some women have strong family history, even without one of these mutations, and they may want both breasts removed because they cannot live with anxiety or potentially going through all this again. From a purely medical standpoint, studies show that removing the healthy breast doesn't improve survival if you don't have genetic mutation. However, studies also show that women who choose bilateral mastectomy have less anxiety and fewer follow-up surgeries. So the question you need to ask your surgeon are, should I be tested for BRCA mutation? What is my actual risk of developing cancer in the other breast or the same breast? If I want both breasts removed, will you support that decision? What are the pros and cons of bilateral mastectomy in my case? If your surgeon dismisses your concerns about family history, or if you feel like your anxiety isn't being taken seriously, it's worth getting a second opinion. Because your anxiety and your family history are valid factors in this decision. And a good surgeon will discuss these concerns with you openly and help you make the decision that gives you peace of mind. The fourth question you need to ask your surgeon is, how do other treatments affect my surgery choice? This is really important because your surgery doesn't happen in isolation. It's a part of a bigger treatment plan. If you choose lumpectomy, you'll almost certainly need radiotherapy. That's 1 to 4 weeks of daily treatment. If the cancer comes back in the breast later, you'll need a mastectomy then, and you won't be able to have radiotherapy again. If you need chemotherapy, then this often happens before radiation. If you choose mastectomy, you probably won't need radiotherapy unless the cancer has spread to your lymph nodes. Recovery takes longer, typically 2 to 4 weeks in comparison to 1 to 3 weeks for lumpectomy. And if you have reconstruction, that adds more surgery and more recovery time. Let me give you an example of why this matters. I've had a patient who was 55, working full-time and caring for her elderly mother. Her tumor was suitable for lumpectomy. She also had a bit of family history, but not really high BRCA-like risk family history. But when we discussed the treatment plans, which was 1 to 4 weeks of daily radiotherapy, taking time off work every day, arranging care of her mother, she realized it wasn't practical for her life. She chose mastectomy. 1 surgery, 3 to 4 weeks of recovery, and she was done. Both options would have cured her cancer, but mastectomy was the right choice for her life circumstances. So the questions you need to ask your surgeons are, if I choose lumpectomy, how many weeks of radiotherapy will I need? If I choose mastectomy, will I still need radiotherapy? What is the total recovery time for each option? If I need chemotherapy, does that change which surgery you recommend? What happens if the cancer comes back after lumpectomy? Now, I know that some of you are concerned about radiotherapy. You might have seen family members go through and experience side effects. But radiotherapy has improved significantly. It's more targeted now with fewer side effects. But it's still significant commitment of time and energy. If avoiding radiotherapy is important to you, that's a valid reason to consider mastectomy. And make sure you discuss this with your surgeon. The fifth and final question you need to ask your surgeon is, how much time do I have to make this decision? Because here is what I want you to know. You don't have to make a decision today. And if your surgeon is pressuring you to decide immediately, you need to ask this question directly. Is there a medical reason I need to decide today, or can I take a week to think about this? In most cases, the answer will be you have time. For most breast cancers, taking an extra week or 2 or 3 to think about your options, to get a second opinion, to talk to other women who've been through this, that will not change your outcome. Breast cancer is not a medical emergency. Here is what you can do if you need more time. Simply say to your surgeon, I need another week to think about this. Is this okay? In most cases, the answer will be yes. You are absolutely entitled to see another surgeon and get a different perspective. Ask your breast care nurse if there is a support group. Talk to women who've had lumpectomy and women who have had mastectomy with or without reconstruction. Hearing real experiences can be incredibly helpful. And bring your partner or family member or a friend when you're anxious. It's hard to process information. Having someone with you to take notes can be really helpful. So the specific questions to ask your surgeon are: how much time do I have to make this decision? Can I get a second opinion before deciding? Is there a support group where I can talk to other patients? And what happens if I change my mind after today? You are allowed to change your mind, and you are allowed to ask for what you want. A good surgeon will support you in taking the time you need to make the right decision for you. And if you're still undecided, smaller, less complex operation is always the best choice, as you can always make it more complex later if you're not happy. Okay, now I want you to do something. Pause this video, get a pen and paper, and write down these 5 questions. 1. Is lumpectomy possible in my case? 2. Do I want to be flat or have a breast? 3. How does my family history affect this decision? 4. How do other treatments like radiotherapy affect my choice? 5. How much time do I have to make this decision? Take this list to your appointment. And here is what I want you to remember. You have every right to ask these questions, and your surgeon should welcome them. If your surgeon seems annoyed or dismissive when you ask these questions, that's a red flag. You might want to consider getting a second opinion. Because a right surgeon for you wants you to be informed and confident in your decision. One more thing I want to say. You're not being difficult by asking these questions. You're not being demanding. You're being a good advocate for yourself. And that's exactly what you should be. Your surgeon's job is to give you the medical information. Your job is to make sure you understand it and that it fits your life. And these questions will help you do that. Now, I want to leave you with this. Most women with breast cancer are cured. Around 92% of women are alive at 5 years and 84% alive in 10 years. And these numbers are improving every year as we develop better treatments. This is your body and your decision. And your surgeon's job is to give you the medical facts and explain your options. But only you can decide what's right for your life, your body, and your priorities. And by asking these 5 questions, you have the information to make that decision with confidence. If this video has been helpful, please share it with someone who needs this information. Leave a comment below. Let me know which question you found most useful. And if you'd like me to make more videos about breast cancer surgery, reconstruction options, or what to expect from treatment, please subscribe and hit the notification bell. And write in the comments below what you would like me to talk about. Thank you very much for watching this video. I'm Dr. Alex Popadich. I'll see you next time. Bye for now.